Hello, my name is Justin Beasley Turner, and I am the Mental Health Program Assistant for the Westchester University Athletic Department. Today, I'm delighted to be here with Dr. Rachel Daltry. Dr. Rachel Daltry is our Counseling Center Director here at Westchester, and today we will be discussing information and topics about life after athletics and maneuvering the transition between collegiate athletic life and post-collegiate athletic life. Dr. Daltry, how are you today?
Doing pretty well. How about yourself?
I'm doing fine, thank you.
Great.
So it's wonderful to hear. Dr. Daltry, I have quite a few topics to cover, and I'm very excited for your insight. Are you ready?
Yes, I am.
Okay. So to start things off, our first question here is, what are ways I can take care of my mental health, and what are the treatment options?
Yeah. So mental health is just as important as our physical health. I think oftentimes, especially for athletes, we're just focusing on our physical health, being in shape, being ready for competition. We ignore our mental health. There's various ways to take care of our mental health. So there's the day-to-day self-care. So eating, getting enough sleep, um, getting enough just kind of general rest. And then there are kind of more of those proactive things of how are we taking care of, if we're worrying or thinking or stressing a lot. Are we, finding things to de-stress or things to, I always say, like refill our cup again, of like what are things that we enjoy that kind of make us feel better. Connecting with other people is also a very helpful thing to do that. And what was the second part of the question? I'm sorry, I forget.
Oh, so the second part of the question, what are the treatment options possibly?
Yeah. So, I always say that mental health is on a continuum. So sometimes when we're experiencing kind of the lower level continuum of mental health difficulty, it's reaching out to a friend or a loved one, getting support, engaging in physical activity or meditation, those types of things. And as we move up the scale, it's kind of like, okay, moving up the scale of more in depth help with our mental health. So another option is obviously therapy and going to see a psychologist or a mental health counselor to provide that specialized support. While our friends and loved ones can be very helpful, they're not trained in dealing with mental health difficulty and they tend to be biased. And so when you go to counseling, they create kind of that safe space that is confidential and non judgmental to kind of help you work through the different things that you may need. Medication is also an option to help with our mental health, just like our physical health. Say, if we have diabetes, there's medication to help us manage that. Same thing with mental health. Medication is always an option. I always encourage people, if they're interested in medication, to also do it with therapy to learn some skills and techniques to help us manage. While the medication kind of help manage the symptoms, the therapy can kind of help us learn those skills and techniques better.
Hmm, thank you.
Mhm.
So next, can routines be helpful in taking care of my mental health?
Definitely. I think routines can be very helpful. And I think a lot of it depends on the personality of the person. Some people like a lot more structure and other people don't. However, I feel like routines help keep habits in place of, okay, well, my routine of going to bed and getting myself ready for sleep, or my routine when I first wake up in the morning. It doesn't have to be super rigid, but kind of having things that are kind of already in your day to help remind you to do those things, whether it's like brushing your teeth, showering, taking a moment to journal or pause or to call a friend or a loved one. Those routines can, again, help us remember to take care of ourselves.
Next, how does exercise help me take care of my mental health?
Mhm. There's a lot of research that shows how helpful exercise is for our mental health. Oftentimes, for our student athletes, the exercise and physical activity in the competition is a place where our student athletes go to like cope and deal with the things they're struggling with and their stressors. I think everything that's happened with COVID has emphasized that even more of going, almost a year without your sport or ability to really kind of participate in competition or and for some people having the ability to exercise in the way that they're used to exercising um, and how that impacts our mental health. So incorporating that in some way, keeping us active, again, student athletes were used to that, can be really helpful for our mental health and also helpful in keeping up our athlete mentality. For our college athletes, you've been an athlete for a while, and that's been a large part of your identity and your day-to-day life. And maintaining that keeps that there and kind of keeps feeding that piece of it.
What are the best resources for suicide prevention?
There's a lot. So one of the biggest pieces that we often talk about is connection. So when we're connected with ourselves, when we're connected with others, we feel less isolated and alone. A big risk factor for suicide or having suicidal thoughts is feeling isolated and alone and feeling like there's no hope, or the situation you're in isn't going to change, or you're not going to be able to cope with it. And so connecting with other people, connecting with loved ones, connecting with mental health resources is a big way to prevent that. And, kind of maintaining that. So similar to like the question about routines, that routine is helpful of how am I checking in with how I'm doing? How am I checking in with what I need? And when we're able to do that, we're able to prevent from us struggling more significantly. Because when we start struggling more significantly, it puts us at greater risk for having thoughts around suicide, or not wanting to be around because the distress gets so high. Similar to like a physical injury, if we start noticing, pain and injury, at the lower levels, it's going to be a lot easier to address. And if we keep ignoring it, and it's going to keep intensifying and keep getting worse.
Mm.
And then it's going to take a lot more to recover from.
What have been some examples of the most impactful practices you've observed within the student athletes you've worked with? And what has been the difference?
Yeah. And I've had the pleasure of working with lots and lots of student athletes over my time at Westchester. And some of the things that have been most impactful is just the willingness to engage in the therapy process with me and being open, which then leads them to be more open to the people in their life about what they're struggling with and what they're going through so they can get more support. And that support is so tremendously helpful. And then to see people kind of, be nervous and scared, understandably so, about trying some of those things out, and then seeing them do it and seeing how much of a difference that makes in their life, um, is really rewarding. And it's really great to see athletes putting trust in me that I know what I'm talking about, and trust in the process of, okay, I'm going to trust you that this will actually be helpful. Because a lot of times what we're talking about with mental health and, in counseling is really difficult and scary to do, because it's stuff that we're not used to doing. And it's really helpful to see that. And it's to me, that's really impactful when it's like, okay, I'm going to try something different. What
Mm.
I'm doing isn't working. And when I can try this something different and I see those positive results, and to see somebody's life change for the better. So for me, that's what's been most impactful,
Mm.
for sure.
So, how can I tell the difference between good and bad mental health information?
Mhm. And that's really hard, because I think with the internet, I'm gonna sound like an old person, and social media, there's so much information out there. And a lot of that information isn't necessarily fact checked. It can be somebody's opinion, it could be somebody who read something and interpreted it a certain way. So I always encourage people to go to trusted sources. So, go to the counseling center's website where we are providing information, going to, trusted like the American Psychological Association or the CDC, going to websites you trust, or going to people that you trust, or have training or a background in mental health. It's always important to kind of double check the information that you are seeing out there. Um, just to make sure it feels accurate. The other piece of that is what feels good to you. So regardless if it's scientifically proven or not, but if this kind of, hey, this like really fits with how I see the world and how I see my well-being, that's all that matters. Because people come from different perspectives and different backgrounds, and it's not going to be just one thing that works for everybody. So it's also kind of like what really speaks to me, what speaks to like how I view things, and investigate those things more.
Mm. How can I maintain social connections, and what if I feel lonely?
Mhm. And I think with COVID, again, that has highlighted a lot of challenges with those social connections, and how do we do that? I often find that with social media, we're very connected on that surface level, then we don't necessarily have all of those deeper, more intimate connections. And we feel like we have to put on a certain facade or a certain look because of social media. We got to paint this picture of everything's great.
Mm.
And so it's trying to find those people that you trust to take those chances and take those risks of, okay, how do I show myself a little bit more to this person? How do I, open up a little bit more about things I'm struggling with, or, things I'm having difficulty with? And I think 9 times out of 10 with those people that we trust, and we build that trust with, they're going to experience very similar things to you.
Mm.
And that's going to help you feel way more connected, and that's going to help the relationship so much more. So, I always encourage people, find people who have similar interests, similar values, who kind of view the world in similar ways. It's great to have diversity in opinions. And it's also, we want to make sure that diversity has safety in it. Of, okay, we're coming from a basic place where I can feel safe if we disagree, or, we do agree on these things and this feels really great. So if you're feeling disconnected, it's okay. How do I reach out to people that maybe I can build those connections more with? Or how do I, engage with counseling or therapy to help me learn how to build those connections or to find those resources? You don't have to do it alone. There are people out there who are willing to kind of walk through that with you, and help you find those things that you need.
Mhm. And to that, I have to add that, it's like you mentioned before, that athletics becomes such a big part of your identity, and once you have to move on from maintaining that identity and going into post athletic life, finding new hobbies, finding new ways to spend time. Those also lead to finding those people with the similar interests, like you mentioned. So it is quite the transition, but what you're mentioning, it rings true.
Yeah, I remember when I stopped playing sports, I was like, wait a minute, how do I make friends? Like, this is how I always made friends, was through sports. And it was like, okay, I need to think about this differently. So I joined like a boot camp gym. And so it's kind of like boot camp classes, type of thing. And I found people there, and I was like, okay, we have common interests. It's different. It's not competition. Well, maybe it's just me in my head competing next to the person next to me. But it's just like, okay, I need to find different places to find those connections of, okay, I have this interest in, maintaining my physical health, or just lifting heavy things and putting them down. How do I find those different connections?
Mm, wow. What are some ways I can manage difficult thoughts and feelings?
Mhm. And I think a lot of people always forget that that's normal to have difficult thoughts and feelings, that we're going to have negative thoughts, we're going to have negative feelings. That's part of being a human being, and a part of life. And it's kind of, some people distract themselves from them. And sometimes that's helpful, and other times that's not helpful, because sometimes they build up. So if we ignore our negative thoughts and feelings too much, they build up too much. So sometimes in that moment, say like you're, taking an exam. Now, maybe now's not the time to think about, the that game you just had or something like that. That may not be helpful. So you may not want to distract yourself in that moment. However, we want to come back to that. So the more that we can deal with those thoughts and feelings, acknowledge what we're feeling, validating what we're feeling, that's going to help us move through it a little bit more. Sometimes we need to talk to somebody else, a trusted friend, loved one, counselor, to kind of help us sort through those negative thoughts and feelings, and learn skills of how can I cope with this better. I often try to remind athletes of a lot of stuff that you do on your field or your court or the pool. Um, you forget that you can do that in your life outside of that. So when you're in, competition mode, and you notice yourself like struggling or thinking something, negative, okay, how do you let that go in that moment? How do you take that breath? I have to remind people, like, right before you, start competing, a lot of times you take that breath
Mm.
and you kind of reset yourself. You can do that in day-to-day life too, and that's a really important thing to do in day-to-day life. Um, how do you kind of work through those difficult things and kind of say, okay, what is it that I need? What are the things that I am struggling with? Do I need to like solve this problem, or do I just need to kind of let this ride out? So there's a variety of ways. Um, Meditation is one thing that can be very helpful with dealing with negative thoughts and feelings. Something called mindfulness, which is very similar to meditation, and it's kind of like exercise for the brain, and teaching the brain, like, how do I deal and how do I not get too stuck in these things that are going on in my head.
Mm. Yeah, and again, like what you're mentioning is um, application of skills that we've learned in our athletic lives. I think the only difference is we just don't have points on a scoreboard or tallies in a box. But no, you're completely right. That breath before competition, that really hit me, because it's
Mhm.
I know exactly what it feels like, and Yeah, no, I agree. And just trying to find ways to apply those lessons we've learned as athletes to real life situations.
Yep. Yeah. When you're like in a really stressful situation in, our athletic life, we don't tend to panic, right? And it's like, okay, why don't I panic in that moment? And it's kind of like, well, I reassure myself, like, I'm going to be okay, or like, I know what I'm doing, or,
Mm.
I take that breath and I reset. Okay. We need to apply that in everyday life too. Like, you have the skills. It's just having the confidence to apply it in these different areas.
Mhm. How can I reframe the situation and find more balanced perspectives?
That's very similar to, thinking about dealing with negative thoughts and feelings. Is I don't tend to be a person who says just have positive thinking, which sounds weird maybe coming from a counselor. I always encourage people to have realistic thinking. Positive thinking can sometimes not feel genuine or accurate, for the situation. But I think realistic thinking of like, I can acknowledge this can be hard, and I can also acknowledge I'll be able to figure it out and get through it. And so that's when, reframing a situation, a lot of it is graduation is going to be hard. Saying goodbye to your sport potentially in or a competitive sport, it's going to be really hard. It's going to be really sad. We can acknowledge that, and we want to validate that and acknowledge that. And we can also reframe it as, okay, I need to figure out other ways to, have my passion or have this experience or get these feelings, or have these connections of, okay, I'll be able to figure it out. And what do I need to do to figure it out? So I view that more as realistic thinking than positive thinking, because it's going to be hard. Positive thinking is like, oh, everything's going to be great. You're going to be fine. It's like, no, it's going to be hard and you'll figure it out. You'll get through it.
Are there any self help materials for depression and anxiety?
There's a lot of self help materials out there. There's a lot of really great books and resources. I know the Counseling Center website, we have a bunch of videos and handouts and links to different websites that can be helpful. Again, it's kind of seeing what fits for you and what works for you, and being mindful of, okay, what is the information I'm intaking, and does that fit? So there's a lot of great resources, a lot of great websites. I think everything with COVID, there's a lot more videos and brief videos and things like that that can be very helpful. Social media can be helpful. There are a lot of therapists and mental health professionals online and putting different content out there, which can also be helpful, and great reminders. And I'm a professional, trained professional. And there's certain time I see posts, I'm like, wait, that's a great reminder. Like, oh yeah, that is very helpful.
Mm.
So there's different places that you can get information for sure.
Are there any WC Westchester University resources available to Westchester alumni?
So unfortunately, we're not able to provide counseling services to alumni, Westchester alumni. However, I always encourage student athletes, like, if you ever have a question or if you ever need help, to reach out to me, and I'm more than happy to help connect them with different resources in the community.
Mm.
I actually had a former student athlete reach out to me this week and say, "Hey, like, I'm struggling. I need some help finding a therapist." And so, we corresponded back and forth on different options in different ways. So again, I'm always happy to be of assistance.
Mm. And with you mentioning that, I just have another question then. With as far as how do you reach out for mental health help? I mean, you just mentioned that you had a student say that they were struggling. Is that the optimal way? Is there?
Yeah, so it's a little bit harder when you're not at your college campus, because when you're here at Westchester, you can just call the counseling center, or reach out to me through the counseling center, and we offer services there. When you're a graduate and you don't have that ability, it's if you have health insurance, you can always see what your mental health benefits are, and oftentimes your insurance will provide a list of mental health providers that are within your network. Um, Googling. So there's a website called Psychology Today that you can go and put your location in, and it'll come up with a list of therapists in that area. Um, so there are different resources that you can find mental health professionals in your area. Another option is, I always encourage people, if you're stuck, if there's a local university to where you are, contact them and say, hey, who do you typically refer to? Because they typically have a list of providers in the area, that they refer students to. So they, typically are more than happy to provide that list to you as well.
Mm. That's very important to understand the resources that are available to you and the ones that you don't expect usually, typically.
Yep.
Um,
And just to add to that, on our website, the counseling center's website, we do have some handouts on how to navigate your insurance and also lists of local providers in the area for mental health.
Thank you.
Mhm.
What if I can no longer sleep because of my mental health?
Sleep is often a symptom of being a college student and also a symptom of mental health difficulty. So that is a very common thing. Sometimes when we're feeling increased anxiety or we're feeling down and depressed, our brain is going and going and going, and it's interfering with sleep. So there's a thing called sleep hygiene, which can be very helpful. And sleep hygiene is about how do I kind of create my routine in my bed and my bed space. Oftentimes for college students, we do everything in our bed. We eat, we do our homework, we're watching TV, we're hanging out with friends, all in our bed. And so when we go to sleep, our brain's like, oh, wait a minute, this is for all these other things. It's not for sleep. So we want to start associating the bed with sleep, which means all we do in bed is sleep. We don't eat, we don't do schoolwork, we don't watch TV. We have to find a different place to do that. Now, this is only if you're having sleep difficulties. If you're not having sleep difficulties and you're doing all those things and it's working for you, great. Um, Another thing is like being mindful of caffeine intake before bed. Caffeine stays in our system for a very long time. And so you really want to cut off caffeine intake like 8 hours before your bedtime. We want to avoid using our phones in bed. The blue light in the phones keeps us awake. It makes it, tricks the brain that we are, if there's daylight with that. Same thing with watching TV. Um, and it's also important, and this is really hard, to turn our phones off when we go to sleep. Our brains, there's actually research that shows if our phones are on, our cell phones are on while we're sleeping, our brain's still kind of attached to it.
Mm.
So we're not getting as good of sleep. So those are some things to kind of help with your sleep hygiene. However, if your mental health is impacting your sleep, that may be a good time to reach out to a counselor to start working on some of those things so it's not impacting your sleep as much.
Mm. How can I leverage short-term distractions into long-term habits?
Um, yeah, and I think kind of like short term things are always good to have, kind of short term goals or kind of things that are going on in the short term. If it's something that you want to make it into a long term habit, just like anything, it takes practice and it takes intention to do it. So just think, when you're an athlete and the reason why you have so many hours of practice is so when you get into competition and game time, you just do it, right? And so you do things over and over and over again. And so if you want to make something more of that long term, habit or that kind of part of your routine, it's really important to practice and practice intentionally of like, okay, this is what I'm going to be doing. And this is what I need to do. And then it starts becoming habitual and it starts becoming part of your routine that you don't even think about.
Mm. How do athletes both grieve and celebrate, not no longer playing competitively? How do you maintain your athletic identity in connection to sports, competition, etc.?
Mhm. I think that's one of the hardest things. So I think some people get very excited of like, oh my God, I don't have to practice. I don't have to report to anybody anymore. And then, we kind of feel that sadness of like, oh, wait a minute, I'm not going to have this. As we've kind of talked about before with like the connecting piece, like a lot of times through sports, we've made very close friends. And we have our teammates who are there for us. And we kind of have this built in support system, which is really great. And it's kind of like, how do I maintain that or how do I create that after kind of when I graduate and I don't have this kind of already set up for myself. And so it's always a good reminder that you can have both. You can celebrate what I've done so I can feel really happy and joyous. And at the same time, I can feel sad and I can experience that grief. Oftentimes, people feel like because I'm no longer participating in sports, I'm no longer an athlete. And I always say that athletic identity is going to be there probably for the rest of your life. I haven't played organized sports in a very long time, and I still have part of my identity is an athlete. Um, and it's kind of like, how do I embrace that? And also, how do I start adjusting that to build in other identities that are more salient to kind of what I'm doing right now? And I always know it's there. So like I used to play basketball. March Madness is my favorite time of year. I watch both the men's and women's tournaments, and it's kind of like I still get excited. I get a little less excited, like, oh, I want to go play. Before, like I was like, okay, I want to go play right now. Now I'm kind of like, I'm too old for this. Things hurt. I just enjoy watching from my couch. So it's kind of appreciating that of like, okay, how do I still maintain some of that, and also how do I allow it to change and adjust over time?
Mm. And with that, it's also another factor that's being introduced because of COVID. I feel that a lot of athletes that have had their seasons or their careers cut a little short, trying to find that closure, and just trying to bridge that gap of that season that never
Mhm.
happened. I feel like that's also a difficult situation that students might have to deal with.
Yeah, and I think a lot of students got a taste of that because of COVID and, sports being put on hold. And I think that's one of the most challenging pieces of COVID, besides some of the obvious things, um, is there is a lot of grief. There is a lot of loss. Things are so different, and you're not going to be able to reclaim some of those things or some of those experiences. We can't go back and get those things back. And it's really hard and it sucks. It sucks a lot. And so we have to allow ourselves to grieve the things that we've lost or the experiences we've lost. And we also have to try to be grateful and remind ourselves, okay, what have I had and what can I still have in these experiences? Um, but yeah, it's hard. There's nothing, there's a global pandemic that impacted our lives. And so some things are just going to be really hard and really crappy. And so it's just like, how do I deal with that the best way that I can? There's no, this is where I'm not a positive thinker of like, there's really no like positive to take from that. It just sucks. And we can also keep moving forward and keep moving on from that and keep having positive experiences that we want.
Mhm. What advice would you give a returning Golden Ram in regards to promoting their mental health this summer ahead of returning in the fall?
Mhm. Yeah, I think, giving for our returners of give yourself some space to start the adjustment process. I know a lot of our student athletes have had that this spring of getting used to being back on campus, getting used to being around teammates, even with all the different COVID protocols. Is kind of all right. Get your brain where you need it to be, and start thinking about how do I want my season to be in the fall? How, what are my expectations? And making sure you're still giving yourself space with those expectations, that it may not fully happen, and what may be realistic and what may not be realistic, because COVID's still going to be around. There still may be interruptions. It's kind of like, what can I do to take care of myself the best way that I can?
Mm.
The other piece I would encourage, our returners is, start thinking about what your needs are, both physically and mentally, and socially. Of like, okay, what is it that I need when I return in the fall, and how do I get it? And how do I start doing that? Because a lot of times we push things aside, and we keep pushing them aside until it's like reaching like the brim of things. And that's when they usually typically reach out to me, and it's like, okay, well, start reaching out sooner. So you don't have to suffer as long, and you don't have to be in as much pain. Of okay, if I start noticing some things, let me reach out sooner and get those resources so I can start using them, and applying them sooner rather than later.
Thank you, Dr. Daltry. That completes a lot of the topics that we had to go over, and I'm sure if any athletes that are watching this, or any in fact any staff, faculty, coaches that are watching this as well, if they have any more questions, I'm sure they could reach out to you. Would it be best to reach out to you through the counseling department?
Yes, they can send me an email at rdaltry@wcupa.edu for
Wonderful,
sure.
wonderful. Well, thank you for your time, Dr. Daltry. Your insight is always wonderful to hear, and it's wonderful to see you as well.
Awesome. Thank you so much, Justin.
No
Appreciate
problem.
it.
No problem. Thank you so much.